Perception of Mental Health Care in Ghana by Elias Bright Fleku. A little bit about myself. I had 2 bachelor degrees in health, physical education and recreation, and coaching from the University of Cape Coast in Ghana and the University of Minnesota. I have my master's in sports management, also from University of Minnesota. I am Ashford University class of 2020 graduate, and my degree is in psychology. My hobbies include reading, sporting, traveling, and preaching the words of God. Problem statement. Mental health affects every 1 in 4 persons in each country throughout the world, according to World Health Organization. Mental health has been neglected in Ghana, and that has been influenced by the culture of the people. Mental health care has been neglected in the Ghanaian healthcare system due to the fact that there are few practitioners who operate in the mental health department. Out of 28 million citizens, Ghana has only 3 mental health facilities, 18 psychiatrists, 19 psychologists, 21 social workers, 72 community health officers, and 1,068 registered nurses who work in the mental health department. This has made the problem more cumbersome because out of these 28 million, only 2.8% attain treatment. And these 2.8 are the only ones that visit clinics or hospitals for treatment, leaving 97% untreated or inadequately treated. The consequences of this is that many mental health patients are left to live by themselves, and as a result, they do not have treatment at all. And then it increases social vices and incarcerations a lot. There is also stigmatization of patients who are affected by mental health or who has mental health disorders. Coupled with that is the cultural influence that made it in such a way that many people who have mental health disorders do not want to seek medical attention. The problem also persists in the sense that there are barriers to mental health issues or mental health services. These include lack of funds, inadequate facilities, and lack of education. Purpose statement. The purpose of this dissertation is to explore the perceptions, beliefs, and values of mental health practitioners about the role and importance of mental health issues in Ghana. Cultural elements of society always supersedes the scientific-based treatment. Hence, there was a specific inquiry into culture. And then also limitation to mental health services as to why these services are not well treated. Research questions. 4 research questions were stated. 1. What are the perceptions of policymakers, traditional healers, and mental health nurses regarding mental health and mental illness in general? How do policymakers, traditional healers, and mental health nurses view the need for mental health services for the citizens of Ghana? What are the perceptions of the policymakers, traditional healers, and mental health nurses on how cultural values and beliefs influence mental services in Ghana? And finally, what do the policymakers, traditional healers, and mental health nurses view as the barriers and limitations to mental health services in Ghana? Research method. A qualitative descriptive study was used. Participants include mental health directors, mental health nurses, and traditional healers. Gender and age. Men and women were used for the research, ages between 25 and 60, who have worked in their capacity for 5 years. The mode of the research was interview and administering of questionnaires. Interview was made with the mental health policymakers, and then the questionnaire was distributed among mental health nurses and traditional healers. Findings. Findings of the study were that mental health was negatively perceived and understood by the citizens of Ghana, and that no knowledge of mental health illness were stated by the participants. Majority of them stated that the knowledge of mental health was lacking. The finding was also that government should involve with the intervention of mental health services in the country, as well as its treatment. Stigma and stereotype effects. It was clearly stated that there should be a way to eliminate stigma so that people who are affected by mental disorders can visit treatment centers to have this treated. There was also lack of funds that could send a lot of services available to the citizens. Then finally, knowledge and treatment gap was so huge that there is a need to bridge that gap. Practical implications and future recommendations for the research. It was stated that policy formulation should be very much strengthened, that there should be a research as to why psychiatric programs at the medical schools attract only few students. There was also the idea to identify what obstacles prevent the expansion of mental health services in the country, and that if these problems are solved, the societal consequences and challenges of incarceration and others would definitely curtail. Future recommendation shows that there should be quantitative research into the problem as compared to the qualitative research conducted. There should be expansion of the horizon of the research to include focus group and survey that will involve a lot of people and their views to be stated. And then also to bridge the treatment gap, which is widening so much that people are left untreated.